Hello, my name is Dr. Shmeet Das. I am the owner and founder of the Brain Spine Neurosurgical Institute. The practice itself was designed in an attempt to create a joining of different subspecialties dealing with the spine. And therefore, we've branched out to include neurology and injectionists into our plan. Soon, and in the very near future, we'll also be integrating physical therapy into our plan. As many of you know, and those of you that suffer spine problems, it can be very frustrating to move from one office to another with different explanations of the exact same problem. Hopefully, in our office, we'll be able to universalize your treatment so that you not only have an understanding, but hopefully a successful outcome. The office consists of a neurologist, Dr. Gus Stratton, an injectionist, Dr. Tom Rocco, myself as the neurosurgeon. We have a nurse practitioner, Mohini Yalanis, and a physician assistant, Brittany Bertone. With these group of providers, we hope not only to give you an understanding of what's going on, but also hopefully an ability to treat very quickly and conveniently. For that convenience, we have offices spread throughout the entire state. We have offices in East Providence, Cumberland, Johnston, North Kingstown, Narragansett, and Newport. And we are running clinics in many of these offices throughout the entire week. Scheduling is obviously your first step. And with the insurance plans of today, it can be somewhat of a challenge. And of course, the most important thing is to determine whether or not your insurance plan requires you to get a referral. That obviously is up to you and your family physician, and of course many insurance plans do not require a referral. The scheduling starts by, of course, dialing our number 404-2975 and choosing the option as a new patient. This will take you to our new patient coordinator. As you can imagine, there's often many phone calls that come in at the same time. We attempt to call everyone the same day that they make the request for the appointment. The new patient coordinator then will do a relatively extensive review of your demographics. An important part of this, as you can imagine, is having your insurance card ready so that we can determine whether or not a referral is needed or not. After that, she'll ask some very, very simple medical questions, but we're really concerned about what type of treatment you've had and whether or not you've had any type of imaging. That imaging might be X-rays, MRIs, or CTs. These might have been done throughout the entire state. A very important part of our practice is to look at those actual images. Therefore, we ask that you please bring a copy of the CD from the institution that did your imaging. In almost all cases, you can call the institution in advance and they will obtain a copy for you. What we try to do after that is to take these images and store them on our system so that all our providers can actually look at your images, and together as a team we can determine what would be the best treatment for you. In addition to your medical imaging, of course, we want to understand the other parts of your medical history that's relevant to you. So please have your primary care's number available so that we can contact them and obtain additional health information. Perhaps the most important part of your medical history is really having a good understanding of the medications you're on. This affects the way that we treat you significantly. So we ask that if you have an opportunity to obtain a complete list from your pharmacy or from your primary care, we really want to ensure that we have the most accurate understanding of your current medications. The next step after you've talked to our new patient coordinator, of course, is to obtain an appointment. And we'll be looking for the location and the time, of course, that's the most convenient for you. After your appointment's been made, we just want to remind you when it's time for your appointment to always bring your CD of your imaging that's been done, and of course a complete list of all your medications. After that, you'll be filling out a relatively comprehensive amount of paperwork talking about your medical history. If you go to spinetogether.com and if you click on the tab that says New Patient Visit and Paperwork, you can actually download that paperwork in advance so that you have it ready and it's accurate with help from any family members or anyone else that may have some understanding of your medical history. From there, the visit is relatively consistent with most doctors' visits. You'll be taken back with potentially one of the medical assistants or a nurse or the clinician themselves. We'll start to get an understanding of your medical history, and then we spend some time in the back looking at your imaging, if imaging has been ordered. If imaging is already obtained, then often we might want to consider conservative treatments that start with medications. Those medications can include anti-inflammatories or nerve pills. Nerve pills are pills that are particularly designed just to treat or calm the nerves down. These are not narcotics. What you will learn with our practice is, unfortunately, because of the regulations that are in front of us and the number of patients that we see that require narcotics, we are unable to deliver narcotics to the majority of our patients. And we only manage those narcotics of the patients that we actually operate on. We may consider one of these medications for you if you have not been treated with that before. Another option would be to consider physical therapy if it has not been done. This option can often consist of many different types of modalities, such as ultrasound, traction, or different forms of exercise. A third option would consider the use of injections, and those injections are done in many of our suites that you'll find throughout Rhode Island. And what those injections are, an injection of steroids that using this machine, which is called a fluoroscope, we inject right next to the nerves. And this can often be of great benefit. And of course, in a small percentage of cases, surgery may be considered. So every time a patient comes in, we're going through all of these options in our minds, and hopefully you'll have an understanding of why we chose one of the options. That does not mean, of course, that that option will be successful, but it might be our first attempt to see if we can get you some relief.